Hello, I'm Jay Reznick, and on behalf of XPAPCE, I'm pleased to be able to introduce you to the first in my series of 3 modules on office-based oral surgery, or as we affectionately call this course, Oral Surgery 101. As you might determine from the title, this will be the most basic of our educational modules, giving you the foundation to improve your confidence and competence in everyday oral surgery problems and procedures. Subsequent modules in this series will give you more advanced knowledge in various topics within the specialty. Under the heading of surgical extraction, we've got teeth with 1 root, we've got teeth with 2 roots, and we've got teeth with 3 roots. And so we're going to discuss each one of those and the techniques for removing those separately. Another option, once the roots have been separated, is to use the proximators to complete the split between the roots and then advance them down the PDL space along the proximal and distal roots in order to elevate them from the socket. The risks of third molar removal I classify into 2 different categories. One is the usual, or the ones that you can easily deal with, and the other is the ones that are more difficult to deal with. The usual complications are bleeding, swelling, pain, infection, dry socket, which I will discuss in a lot more detail in the CE course on management of infection and surgical complications, and delayed healing. The more problematic complications include injury to the nerve or numbness of the inferior alveolar nerve or the lingual nerve, fracture of the mandible, and development of oral antral fistulas. And the most important thing to remember when you're trying to avoid injury to the lingual nerve when doing surgery is that its location can be extremely variable. It can be found above the mylohyoid muscle, it can be found below the mylohyoid, or just about anywhere in between. Thank you for completing Module 1, the basics of oral surgery, otherwise known as Oral Surgery 101. I hope that you found the content not only educational, but also practical and useful for you in your everyday practice.